All right, let's dive in. Today, we're talking about the surprisingly dramatic world of your kidneys. Seriously, it's a place where a really simple infection can spiral into a full-blown medical mystery, forcing doctors to decode some truly bizarre and dangerous conditions. So let's get into it. Well, they're both clues in a secret war happening inside your body. I know, it sounds a little weird, right? But stick with me, because by the end of this, you'll see exactly how these strange terms help doctors figure out everything from a super common ailment to some of the most fascinating conditions in medicine. So, how does this all even start? Well, believe it or not, in most cases, all this trouble begins with a single tiny bacterium taking a journey it was never, ever supposed to make. Let's follow its path. The usual suspect? Good old E. coli. And it causes what's called a retrograde infection, which basically means it's going the wrong way. It's a journey that goes completely against the flow, starting from outside, heading up into the bladder, climbing the ureters, and finally reaching the kidney tissue itself. And that's where the real problems begin. So once that infection really sets in, doctors call it acute pyelonephritis. And this is where we get our first big clue from the title. On a CT scan, you can actually see this classic striped kidney. And those stripes, they're really just wedge-shaped areas where the infection is causing a ton of inflammation and cutting down the blood flow, creating this very unique visual pattern. But here's the thing, that striped pattern, it's not always so simple. It can actually look a lot like another really dangerous condition, which means doctors have to turn into medical detectives. As things get worse, they have to look for one very, very subtle clue to tell what's really going on. Okay, so look on the left. That's the infection, where you can see that affected stripe goes right to the very edge. But now look at the right. That's an infarct, which means tissue is dying because it's not getting blood. See that tiny, thin outer edge that's spared? That's the cortical rim sign. It's a super important clue, but in the real world, it only shows up about half the time, making things tricky. Now, if the body starts losing the fight against the infection, things can escalate. The infection basically gets walled off, creating this nasty pocket of pus we call an abscess. On a scan, it's pretty clear. It's this roundish area with a bright, glowing rim. And if they get any bigger than about 3 centimeters, a doctor usually has to go in and drain it. This brings us to an absolutely critical point. A kidney infection on its own, it's serious. But a kidney infection plus a blockage, like a kidney stone, that is a full-blown medical emergency. The stone traps the infection, pressure builds up like crazy, and the situation becomes life or death fast. Okay, now we're going to get into some of the kidney's absolute worst-case scenarios. This is where simple infections morph into some truly terrifying, life-threatening conditions. So what happens when the infection gets even worse? I mean, way worse. Imagine bacteria so aggressive they start producing gas inside your kidney. This is a condition called emphysematous pyelonephritis. It's a necrotizing infection. Yeah, that means flesh eating. And it is unbelievably dangerous. And as you can see here, it really, really matters where that gas is. If it's inside the actual kidney tissue, that's pyelonephritis. The mortality rate is extremely high, and you pretty much only see it in diabetics. If the gas is just hanging out in the kidney's plumbing, the collecting system, that's pyolithis. Don't get me wrong, it's still really serious, but it's not quite the same nightmare scenario. All right, you ready for the big reveal? It's time to figure out what that bear paw is all about. We're about to meet a condition with one of the most unforgettable names in medicine, a name that perfectly describes the trail of destruction it leaves behind. And here we have it. It's a mouthful. Xanthogranulomatous pyelonephritis, or XGPN for short. This is what you get after having awful, chronic infections over and over again, usually centered around a giant kidney stone. The kidney tissue is basically destroyed and replaced with this fatty, inflamed gunk, creating this totally unmistakable bear paw shape on a CT scan. It's what doctors call an Aunt Minnie diagnosis, because just like you'd recognize your Aunt Minnie in a crowd, once a doctor sees this, they'll never mistake it for anything else. But, it's not always a simple bug causing all this trouble. Sometimes other diseases from all over the body decide to show up and cause chaos in the kidneys, kind of like they're wearing a disguise, and they leave behind their own unique clues. A great example is something called papillary necrosis. What's happening here is that the very tips of the kidney's internal structures actually die off because they're starved of blood. This can be caused by diseases like sickle cell or tuberculosis, or even just overusing certain painkillers. It leaves behind these crazy shapes on the scans, sometimes looking like a lobster claw. And you want to talk about a great impersonator? Let's talk about tuberculosis, or TB. It can just hang out in the body for years, totally silent, and then decide to reactivate in the kidneys. In the early stages, it causes this subtle damage that looks like moth-eaten edges inside the kidney. But if you don't catch it, the whole organ can eventually become this calcified, useless mass called a putty kidney.
Then you have patients with advanced HIV, and their kidneys send out a totally different signal. In a condition called HIV-AN, the kidneys get really big and become super bright on an ultrasound. In fact, it's so consistent that if you see a normal-looking ultrasound in a patient with these symptoms, you can pretty much rule out the diagnosis. The brightness is that much of a giveaway.
Okay, to wrap things up, let's talk about something that's not even an infection, but it causes a huge and honestly kind of funny debate among doctors. Yeah, check out this quote. It just perfectly sums up the tension around what's called contrast-induced nephropathy, or CIN. The whole argument is about whether the special dye they use in CT scans actually hurts the kidneys. Radiologists and nephrologists, the kidney specialists, are famously split on this. Some are convinced it's a massive problem, and others think it's mostly a myth. So, even though the doctors are arguing about it in the real world, if you're taking a medical exam, there's a very specific list of risk factors you just have to know. This is stuff like already having kidney problems, diabetes, or being dehydrated. And here's the key takeaway for any test. Having an allergic reaction to the dye is not considered a risk factor for this specific type of kidney damage. And that really brings us back to the big picture, doesn't it? We've seen everything from a simple stripe to a bear paw, and all the ways that these images give doctors vital clues. But reading those clues, interpreting those shades of gray, knowing when a subtle sign is everything and when it's nothing, that skill is a blend of hard science and the true art of medicine. It's a powerful reminder that sometimes a picture can literally be the difference between life and death.